Let's begin with our topic, lung abscess. And in the first section here, we will discuss the etiology of the lung abscess, what's the epidemiology of lung abscess, and then the pathogenesis, how the primary and secondary lung abscess develop, pathogenesis. Genesis is like for the formation, patho is for the abnormality, so how the progress of lung abscess occur and how it progress. So that all we will discuss in the first section, etiology, epidemiology and pathogenesis of both the primary lung abscess and secondary lung abscess. Lung abscess here, if you see, that's the lung abscess and that's the pus in the pleural space. Pleura is the covering of the lungs. We have the parietal pleura and the visceral pleura. So the two linings of the pleura is the covering of the lungs. All the important vital organs of the body like lungs, brain, heart, abdominal organs, they are protected by the covering or layers. The heart is protected by pericardium, the brain and spinal cord is protected by the meninges, and the lungs are protected by the pleural membrane. So this is the pus which is present in the pleural space. We have the visceral pleura and the parietal pleura. This is the lung abscess and that's the pleural membrane. And in the pleural membrane, this is the pus present. So the lung abscess, it represents necrosis, which is the death of the tissue, and cavitation of the lung following microbial infection. So abscess is the formation of the pus, and this pus is due to the infection, microbial infection, different microorganism causing infection lead to the formation of pus and the abscess, and this leads to the necrosis or death of the tissue and cavitation. Cavities are formed following the infection. Can be single abscess or it can be multiple small areas of abscesses are present, or it can be one single abscess. Marked by single dominant cavity which is more than 2 centimeters in diameter. So single dominant cavity is formed in which there is formation of accumulation of pus leading to the formation of abscess. So there is single dominant cavity which is more than 2 centimeters in diameter. Now, what are the different etiological factors, risk factors, different infections that leads to abscess? Here also there is lung abscess. So there is, if low prevalence, difficult to study in randomized controlled trials. So etiology causes if the prevalence of abscess is low. So with low prevalence of the lung abscess, it's hard to study this condition in random clinical trials because the condition is not very prevalent in the population. So that's why random clinical trials are not very effective in finding the lung abscess. Primary 80% or secondary, so it can be primary lung abscess or it can be secondary. Primary that develops in the lungs, secondary that can transverse from some other side through the bloodstream and reaches the lungs. So primary and secondary. Primary lung abscesses we have arise from the aspiration, like aspiration pneumonia, when some fluid is aspirated, some other particles are aspirated. So that is from the aspiration by the lungs caused by anaerobic bacteria. Anaerobic are the bacteria which do not require oxygen for the growth. It's anaerobes. So anaerobic bacteria cause primary lung abscess. In absence of underlying pulmonary or systemic conditions, secondary lung abscesses arise due to underlying condition like post-obstructive process or due to systemic process HIV infection. So, primary is due to aspiration in the lungs due to anaerobic organisms in absence of any underlying lung condition or any other systemic illness like HIV infection. But in secondary, it's more due to underlying obstructive conditions or due to post-obstructive process, or it may be due to systemic process like HIV infection. So that's the difference between primary lung abscess and secondary lung abscess. Randomized clinical trials are hard to find out the etiology because of low prevalence of the lung abscess. Also characterized as acute, which is less than 4 to 6 weeks in duration, or chronic. So one classification of lung abscess is primary or secondary. The other can be acute or chronic. Acute is less than 4 to 6 weeks. Chronic is of more longer duration. Now the epidemiology of the lung abscess, majority 80% of the cases we said is the primary lung abscesses. So primary lung abscesses are more common. It's more common among middle-aged men are commonly affected by the lung abscess. It affects the individual. Who are the individual which are more prone to lung abscess? We have people who with the altered mental status. That's important. Altered mental status, who are not mentally stable. Their hygiene is not good. They are more prone to aspirations. That's why they leads to lung abscess. Alcoholism or drug overdose, again, because it alters the mental alertness, mental activity. So alcoholics and the drug users. Seizures can cause the lung abscess, bulbar dysfunction, prior cerebrovascular or cardiovascular events, and neuromuscular disease. All these are different factors that can lead to lung abscess. It's more common in men and its middle-aged men are more commonly affected. Primary lung abscesses are more common, and these are different factors: mentally altered mental status, alcoholism, drug abuse, seizures, again, that can cause epileptic fits, and the patient might is not aware, not mentally alert. That's also the mechanism of developing the lung abscess. So those are different factors that can contribute to the lung abscess development. Esophageal dysmotility or lesions, gastric distension or gastroesophageal reflux, again risk for aspiration. These are all the risks that can lead to aspiration, whether directly or indirectly. So the mechanism is mainly the aspiration that can lead to lung abscess. Primary is more common, about 80% as compared to secondary. Then we discuss different factors that can lead to primary abscess, secondary abscess, and also some individuals which are more prone to develop the lung abscess. There is colonization of gingival crevices can also lead to lung abscess. Oral hygiene is very important. Any gingival infections or tooth infections or poor oral hygiene can lead to the development of lung abscess. So colonization of gingival crevices by anaerobic bacteria, microaerophilic streptococci. So these are the microorganisms. If the gums are infected by the anaerobic microorganisms and microaerophilic streptococci, they can lead to lung abscess. Rare to develop in absence of teeth as nidus for bacterial colonization. So if the teeth are missing, they are used as a nidus or source for the spread of infection, for colonization of microorganism. This can lead to this can avoid. So if people who have no teeth, it's rare to develop the lung abscess, because that is the source of the colonization of microorganism or bacteria. Penicillin is the reduced incidence of lung abscess. So penicillin is an effective antibiotic used to treat lung abscess. Pathogenesis of primary lung abscess, how the primary lung abscess develop. Anaerobic bacteria, they colonize, they develop and colonize grow and colonize in the gingival crevices in the gums, and it can cause the aspiration in the lung parenchyma. So from the gums or from the gingival crevices, the bacteria, they are aspirated into the lung parenchyma, and then they are unable to clear bacterial load. So if that high colonization of microorganism or bacteria occur, the lungs are not able to clear that too much load, and it causes initially the pneumonitis, which is inflammation of the lungs parenchyma. That can all lead to necrosis and cavitation later on, and then this can lead to abscess formation, and excessive necrosis can occur. So that's how the pathogenesis of primary lung abscess occur. First, the colonization of organism in the gingiva. From there, the aspiration of heavy load of bacteria occur in the lungs. There it can cause inflammation of the lung parenchyma, pneumonitis. Slowly it can cause necrosis and cavity formation, and then abscess develop in that cavity and leads to lung abscess. That's the simple pathogenesis, or how this lung abscess develops. In secondary lung abscess, what occurs, the pathogenesis depend on the causative factor, on predisposing factor. Example is bronchial obstruction. If there is bronchial obstruction, that can lead to secondary lung abscess. Because of obstruction, there is a retention of different secretions, and from that retention, there is aspiration can occur. From malignancy or foreign body, no clearance of secretions leads to the abscess development. So in secondary type of lung abscess, depending on the cause, we should aim to treat the cause to prevent the lung abscess. Secondary lung abscess is mainly caused by the pathogens like opportunistic organisms. Opportunistic organisms in primary, we saw mainly the anaerobic organisms, and this is by the opportunistic organisms. Increased susceptibility occurs due to underlying systemic conditions. immunosuppression after transplantation. Opportunistic microorganisms, they are in the body, but under different systemic illnesses, when the immune system of the person is suppressed as a result of different systemic illnesses, as a result of use of different chemotherapeutic drugs and antibiotics, all that can decrease the immune response and cause flare up of these infections. So this can lead to lung abscess. Also, impaired host defense mechanism. So all these conditions can lead to increased susceptibility of the person to the opportunistic infections. Arise from septic emboli. So secondary lung abscesses can arise from the septic emboli. Emboli are the dislodged foreign body from the thrombus, or it's the dislodged floating body. And if it's septic, it can cause secondary lung abscess. In conditions from which septic emboli can originate is in tricuspid valve endocarditis, in Limmer's syndrome, and then the Limmer's syndrome infection begins in the pharynx or throat, involve Fusobacterium necrophorum, spreads to neck and carotid sheath, leads to septic thrombophlebitis. So the infective endocarditis, valve endocarditis, and Limmer's syndrome leads to also formation of septic emboli that can cause lung abscess. And this infection begins in the throat, pharynx. Bacteria that cause is Fusobacterium necrophorum, and it spreads to neck and the carotid sheath and leads to septic thrombophlebitis. So that was all about the section 1. Thank you for watching sqadia.com.